Good day, my name is Nicole Rigas Pisasaluya, and today I will perform and demonstrate the administering intradermal injection. The intradermal injection is the introduction of a solution by means syringe and needle into a superficial layer of skin. It is important to observe the rights of drugs medication administration to ensure that we are giving the patient the safest care. Prior to the conduct of the procedure, first thing to do is to check the doctor's order on the patient's medication administration record. For preparation, assess appearance of the injection site, specific drug action and expected response, client's knowledge of the drug action and response, check the agency protocol about sites to use for skin tests. Next, we need to assemble the equipment and supplies. We need the vial with the correct medication, sterile syringe, and 25 to 27 gauge needle, alcohol swab or cotton with alcohol, 2x2 sterile gauze, clean gloves, and Band-Aid. Next, check the MAR. Check the label on the medication carefully against the MAR to make sure that the correct medication is being prepared. Then, follow the 3 checks for administering medication. Read the label on the medication when it is taken from the medication cart, before withdrawing the medication, after withdrawing the medication. Next, organize the equipment. First, we need to perform hand hygiene and observe other appropriate infection control procedures. So, let's perform hand washing. Then, prepare the medication from the vial for drug withdrawal. First, we need to get the tuberculin syringe. Open the syringe sterile package. This is the tuberculin syringe. Let's open it. Then, connect the aspirating needle. Then next, open the vial. We need to remove the cap. Then, clean the top of the vial in a circular motion. Then, discard into a container waste. Next, get the syringe and uncap. Withdraw some air inside the syringe. The volume of air that is needed to be drawn inside the syringe is equal to the amount of medication as ordered by the doctor. Then, after that, inject the vial. Remember, then next, invert the vial and withdraw the exact amount of the medication needed. Then, tap the barrel to remove the bubble. And replace the aspirating needle with the right size needle that will be used for actual administration of the medication. We need to scoop the cup. And then put into a waste container. Then also do not forget to write the medication taken, the name of the drug, and the dosage so we won't forget what medication was drawn into the syringe. Next, prepare the client. Introduce yourself and verify the client and explain to the client that the medication will produce a small wheal, sometimes called bleed. Hi ma'am, I'm Nicole Regaspi sa Saluya. I am going to be your student nurse for today. Ma'am, may I please verify your identity? May I know your name? Age and birthday? Okay, ma'am. So today, your doctor has ordered for a penicillin skin test, which means I have to inject a small amount of penicillin into your skin to check that if you are allergic to a penicillin medication. Is that okay with you, ma'am? Okay po. Okay, next, provide the client's privacy. We need to close the window and close the door for the client's privacy. Then, perform hand hygiene. Next, select and clean the site. Select a site, avoid using sites that are tender, inflamed, or swollen, and those that have lesions. Put the gloves on indicated by agency policy. So next, position the client arm so that his elbow and forearm is supported in a flat surface. Cleanse the skin at the site using a firm. We need to clean it in a circular motion. Then next, prepare the syringe for the injection. Remove the needle cap while waiting for the antiseptic to dry. Then expel any air bubbles from the syringe. Then next, grasp the syringe into your dominant hand, holding it between thumb and forefinger. Hold the needle almost parallel to the skin surface with the level of the needle up. Next, inject the fluid. With the non-dominant hand, pull the skin at the site until it is taut. Insert the tip of the needle far enough to place the bevel through the epidermis into the dermis in a 5 to 15 degree angle. The outline of the bevel should be visible under the skin surface. Stabilize the syringe and needle and inject the medication carefully and slowly so that it produces a small wheal on the skin. Next, withdraw the needle quickly at the same angle which it is inserted. Activate the needle safety device and apply the cotton. Do not massage at this area. Then next, dispose of the syringe and the needle in the sharps container. Remove your gloves. Next, circle and indicate the time and the injection site with inks to observe for redness or induration per agency policy. So, I will indicate the time. 8:30 in the morning. Then next, document all relevant information. Then next, record the testing materials given, the time, the route, site, and the nursing assessment. Okay, ma'am, we are now done with your skin test, but we still have to wait for a few minutes to have the result. And please do not massage the area where I did the injection, and do not remove or erase the mark. It is okay with you, ma'am? Okay. Then perform hand hygiene. And then that's the end of the administering the intradermal injection.